So wherever you're joining us from, welcome. We are happy to be here for another live Q&A session. First, let me introduce ourselves for those of us that don't know us. My name is Elena, and this is Gabriella.
Hello.
And we are from Pathway Patient Advocates. Pathway Patient Advocates is a private patient advocate company serving all 50 states as well as Canada. And in many states, patient advocacy is not a well-known concept. It's more of a newer concept, and people are not aware of what we actually do and who we are. So we thought it would be a great idea to have some live Q&A sessions so we can interact with everyone and help answer your questions and tell you a little bit more about how we work. And that's why we're here today. So yeah.
We're going to get started. Just wanted to welcome everyone again. Again, I'm Gabriella, and hope you enjoy the session. So sit back and enjoy. As we go through the material, if you have any questions, feel free to reach out with any questions in the chat, and we will hopefully be able to answer them.
Yes, and also too, one way to get started, we kind of just want to see where everyone's from. So when you join, please just type your name and then also what state you're from. So today specifically, we wanted to talk about health for the holidays. And for many, the holidays, especially Christmas time, is a time of spending time with family and friends and doing traditional activities and experiences, experiencing the magic of the season. But for some people who have a new cancer diagnosis or a chronic condition or have a loved one that's in the hospital, the holidays don't feel so magical. Often we hear bad news and challenges around the holidays, and it really puts a damper on the entire season.
Well, Christmas is my favorite holiday, and I would do anything to make it magical and to make it perfect. But we're starting off at a very, this is sounding too depressing. So I don't think if we continue like this, we wouldn't be spreading much holiday cheer.
Wow. I think we should talk about how a private patient advocate at Pathway can actually help a person in the situation so that they can try to enjoy and participate in making Christmas memories.
Okay, that maybe sounds a little bit better. I'm liking it. And again, we just wanted to remind everyone, if you have any questions during the session, feel free to put them in the chat. Elena, while we're getting situated, I'm sure you probably have many examples with your experience on, what this might look like, or just give people a better,
sure,
an idea of like where we're going with this.
Sure. Okay. So, for example, we previously had a prior healthy patient that was diagnosed with stage 4 cancer just before Thanksgiving last year, just a few days before Thanksgiving. And he had received the news of actually initially cancer a few months prior to, a year before. The cancer had gone away, and then right before Thanksgiving, he was told that the cancer had come back and that there was not much they could do. So it was really difficult time for him and his family. Unsure what to do, his daughter-in-law actually reached out to us and was in need of a private patient advocate, and she really wanted to know, like, how could we help the situation, if at all.
So can you let everyone know, like, what exactly, how did we actually help this client?
Sure. So we started by scheduling an assessment, and we discussed the details of the situation and created the goals that we needed to achieve. And that's how we start all of our cases with our clients. And as a result, we worked with the client to obtain more sensitive testing, as well as an out-of-state specialist, getting them a very timely appointment who was really specialized in this rare cancer. And this specialist was able to immediately get him enrolled into a clinical trial. And we're fortunate that, currently he's doing great. He's living a very good quality of life, enjoying another holiday season with his family.
Elena, can you when you say, schedule an assessment, maybe there's people out there that really don't know what that means. What does an assessment entail?
So an assessment is...
It's like, I feel like you're talking about giving me a test or something like that.
No, there's no test involved. An assessment is basically like our intake. It's a one-on-one time. We either schedule them over the phone or in video, whatever the preference of the client is. And that's really when we talk about the details. You tell us the ins and outs of your situation. You can have anyone as part of the assessment, so it can just be the patient and us. It could be the patient and the client and us. It could be family members and friends. I mean, as many people as you want on it. It does not have to be the patient. So sometimes the patient is like not feeling well, or they're in the hospital, and we have
or they might just not want to talk about it.
Exactly, yes. And so we can have our client. So I know for the example I gave, I actually met with the daughter-in-law by herself first, and then after on, I talked with the actual patient. And so that's really when we talk about, okay, like, we learned a little bit about what challenges they've had to this, if any, up until this point. We also talk about what the goals are, like the primary goal, secondary goals. We look at time frames. We really kind of, like I said, it's our intake. And then that time they also get to ask questions that they may have about us. So it's a really good time to introduce the ins and outs of each other. And then from that point, we actually will provide a detailed plan of what we recommend of how to achieve those goals. And we will send that plan in an email, and then we will go ahead and discuss them afterwards. And that's kind of what brings us to like the next steps of actually working with them further.
Okay. Well, thank you. I think that helps, and good example. So one of the things that I wanted to expand on is to say that our main focus is to help clients that are diagnosed with cancer or chronic diseases or undiagnosed conditions. We do have quite a few clients with different cancers, specifically rare cancers, and those are the ones that are hard, where you feel helpless. There's a lot of times there's not local doctors that you can seek out help to, and we can really help with that and any part of that journey. Also, as many of you may know, if you have experienced cancer, or a family member or a friend or someone diagnosed with cancer, it's definitely overwhelming, both from a physical perspective and emotional, because everyone is involved, whether you're the person going through it, whether you're the relative or the good friend. Everyone feels feels the pain. It's a scary process, and it's very time sensitive. And even if you have a family member that's in the medical field or someone that you think can advocate for you, I know that I've been in situations where my family have, we've tried to do that, and there's definitely still significant benefits of having a private patient advocate separate that doesn't know your family, and just
Sure.
basically learns the problem or the medical issue that you're having, and helps you navigate through it.
Exactly. No, for sure. I think it's a very time-consuming process to navigate the healthcare system, and you also want someone that's experienced and that can really work in a time-efficient manner, that knows how to communicate with different professionals in the field, and knows how to review medical records, and is really proficient on many ends. And I think that's one of the huge benefits that we do provide. We can also find alternative treatment plans. We can really be as involved as the client wants us to.
Yeah, I would agree with all those things. I know that, just knowing the simple like do's and don'ts when you're in a hospital, or, what are the right questions to ask. And sometimes, knowing when to ask those questions can make a huge difference on,
For sure.
The simple thing of like getting treatment, like chemo, if there's a surgery involved, do you get the chemo before or after? Questions to ask like that if you've never been through it,
Mm-hmm.
there's timing is of essence.
Sure, and it's also like a peace of mind sometimes patients don't really understand what's happening to them, and they like don't know if it's okay to ask. They don't know what the protocol is, like how much should they be informed. It's interesting how many patients we meet and I'll say like, oh, like how long are you planning on getting the chemo for? And they're like, we have no idea. Or, oh, what kind of surgery are you having? Well, I'm not really sure. So just even clarifying and like giving them a better understanding of what's happening, a lot of times makes them feel more in control, because knowledge is so beneficial. And also the family, it kind of gives, when they sort of know what the next step in the plan is, it helps give them a peace of mind as well, because they know a little bit more about what's happening, and we also will often prepare like for visits beforehand. So like let's say if someone has a doctor's appointment with their oncologist, we'll prepare beforehand. Okay, like these are the things that we need to ask. Like what's our goal to get out of this appointment? Sometimes we'll see like maybe a new treatment and we want to address their thoughts on it or things like that. So it's really important to be prepared, because that specialist also has a very time-sensitive schedule and multiple patients, so we have to respect that too. So we really help optimize the care and the time and the benefits of everything that's involved.
Okay, so does someone have to hire a patient advocate right in the beginning of their diagnosis of cancer or whatever it may be, or what other options do they have?
So that's actually a great question, and the answer is absolutely not. A lot of people think that like, oh, I kind of missed the boat. I didn't hire a patient advocate right off the bat. And it's a lot in the beginning. So some people are just like, I think, I don't want too many people involved, or I don't, I think you can handle it and things like that. So there's many reasons why you maybe don't hire a patient advocate in the beginning. I think there's many benefits of hiring us from the start. However, we can really jump in at any part of your journey through cancer, any kind of chronic disorder, and so forth. Whether things are just not working out, or they're progressing, or whatever part you're in, we can definitely help. And I think that is one of the advantages of having a private patient advocate, is that we can help create a specialized plan for you. So if you are told, hey, there's nothing we can do, we can really help you look at different options. And maybe that is true, and maybe the path will show, that there really isn't anything out there, but at least it kind of gives you the peace of mind knowing that you exhausted those options. And many times that's not the case. Many times we do find another specialist or second opinion that's like, hey, we actually have this plan and that would work for you. Or some people are adamant that they don't want chemo, but chemo isn't the only treatment for many things. So we really look at like what kind of quality of life you want and what you really want and are agreeable to try, and then we try to find those resources for you.
Yeah, when we talk about like the amount of resources that we're fortunate that our country has, like clinical trials that people might not know about or take advantage of,
Oh, for sure. Yeah.
Those are the kind of things that they might not necessarily come looking for you. You have to seek, or we have to seek them. It's something. I feel like there's always another plan, or different plans.
Yes. No, I agree, and I think it's comforting to know that you've explored those other plans. And when you're sick or your family's sick, that's the last thing you want to do is we've both experienced this from a personal level as well. And it's emotionally exhausting to have a chronic disease, like undiagnosed, or cancer. It's just like you're often depressed, you're tired, you're drained physically, emotionally. Your kind of whole life is being thrown upside down. The last thing that you really have energy to do is to start exploring different options. Just about any case has roadblocks, where issues with insurance, issues with getting appointments, issues with finding the right provider, issues with side effects. There's so many things, and when you have a patient advocate, they take care of all that. They help you navigate through that, so you don't have to worry about that. and you're able to really rest, get the energy you need, focus on, spending time with a loved one, focus on really just kind of utilizing your resources and energy the best possible way.
Yeah, so let's do another example. Tell me about someone who might be suffering of symptoms but doesn't actually have a diagnosis.
Yeah.
They're essentially undiagnosed. Can you talk a little bit about that?
Sure. Well, we get a lot of clients like that too. We can help them really in a similar way. We start with an assessment, like always, and that helps us understand their situation more in depth and then create a plan. A lot of times that requires more research to kind of figure out and think outside the box. Like, okay, well, traditional medicine, algorithms haven't really found a diagnosis, so how else are we going to? And we have a lot of clients that have really rare and undiagnosed symptoms, and so we really work well because we use similar methodology in helping them find not only a diagnosis but also management of their symptoms.
So why should someone hire a private patient advocate? I think we touched on this during our last session, but I think it's important to kind of point out, some healthcare system and insurance offer a patient advocate or a navigator at no cost. Why do they need a private one?
Yeah, so for those of you joining us more, welcome. Please feel free to, we encourage you to actually, to put your name in the chat and what state you're from so that everyone can kind of see. And just also to, my name's Elena and this is Gabriella. We're from Pathway Patient Advocates. And that's actually a great question because that's one of the most frequent questions that we get asked is, why should I hire you when I can get a patient advocate complimentary? And the reason is it's a huge difference. We don't work in the same manner. We offer different resources and a whole different service. So patient advocates that are from a healthcare facility, such as a hospital or an insurance company, those are hired, of course, they work for those employers. So either the insurance company, the hospital. And so their goal is really to kind of like a customer service or risk mitigation for the hospital. In contrast, a private patient advocate, we are completely independent. We're not employed by any of those facilities or affiliated with the hospital, healthcare, insurance. So we are completely unbiased. We offer an unbiased perspective to really, we offered a non-biased perspective to really help you get through whatever your needs are. And we also come with the medical background and the experience as a private patient advocate to really help navigate and find the resources you need. So we're not constrained to a specific health insurance. We're not constrained to a specific health system. We really kind of think outside the box, and we are really familiar with the extent of resources available, especially since we work throughout the US and Canada. So maybe in your state or local area, you don't have the resources that you need, but we can find ones outside. And the wonderful benefit of now a lot of virtual medicine, sometimes you don't even have to travel far to get it or at all. And yeah, those are kind of my way to sum up that question. But I also see we have a message in the chat from, let's see, I think the Barry from Hawaii, right? Am I reading that right? Hi, Vito.
Hello, Vito.
From Michigan. And thank you, Vito. Thank you very much. Barry Short from Hawaii. Welcome, Barry. Nice to see you. We actually have a few clients currently in Hawaii. So I'm learning little by little more about the state. So thanks for watching us.
So Elena, let's continue on
Sure.
the why it's important to, or differentiating a private patient advocate versus just like a patient advocate that is included in your insurance cost.
Mm-hmm.
One thing I would say, would it be fair to call them hospital advocates and we're more the patient advocate?
Yeah, I mean, I personally would say that, and don't get me wrong, you know, like there are instances that they may be helpful, but they just don't have the same role as us, you know. So sometimes a patient advocate, like a hospital advocate, may be helpful in like contacting a department within the hospital if you have a complaint or something like that. But it's just very different. Like even though the names are the same, we don't practice the same way.
Gotcha. So why us? Why Pathway Patient Advocate? You know, why should they work with us?
Well, we're the best. No, I'm just kidding. I'm kind of kidding.
Just a little biased.
Yes. But the advantage of working with with Pathway Patient Advocates specifically is that we have the complete package. We have both the medical knowledge and the experience in the medical field. We also have the personal experience. We've all experienced personal challenges with the medical field so that we can specifically relate to you. We understand from an emotional level, we're compassionate about our clients, and we truly want to help you from the bottom of our heart. That's why we got into this in the first place. I myself, being a board certified patient advocate, I'm also a physician associate. I've worked in healthcare for over 20 years and as a physician associate for almost 14 years. And you know, my decision to transition into working into patient advocacy really was one because I saw that there were so many challenges and barriers in the healthcare system. While working as a healthcare provider and also experiencing a lot of personal challenges, I realized that the system was really broken and there wasn't really an easy fix, but definitely patient advocacy, patients need advocates. They really, really do. And that's really what got me to where I am today. The benefit is that you have with Pathway Patient Advocates is that you have a whole team working for you. So many private advocates, you know, are independent sole providers sole advocates. And you know, that's how I started off as well with the company. But fortunately, we've been blessed to have grown, and we now have a whole team. We have a team of 5 with Pathway Patient Advocates for every patient. So every patient and client gets 5 people working with them, and that helps us get things done efficiently, accurately. We're able to work very well in time-sensitive manners, and we're always available, which is great. And so I think I know that's a huge advantage. Our clients always will tell us that we have excellent reviews. If you do look on Google or any of the review sites, you'll see our clients are really pleased with us, and they really become family because we care about them so much and we want to help them. The other thing I will point out too is sometimes I get the question like, will my provider be like threatened or kind of offended if I have a private patient advocate? And the answer is no. I mean, a good provider should not be offended at all that you're working with a patient advocate. They should actually be excited about it. They should be encouraging you because it's really going to help you get quicker and better care and really help them with their job too, because you're going to be there's someone else that is helping, you know, that's really kind of making sure that their suggestions are being carried out, that your medications are taken appropriately, depending on the situation and things like that. And we also too, like as a healthcare provider, I know the challenges that doctors and other medical professionals have. And so I see the challenges that they're working against, and then I see the challenges that the patient's working against. I mean, I've had the benefit of seeing both sides. So we really can help figure out a way to kind of optimize that and work together the best way possible for the patients.
Thanks, Elena. I think that gives a really good summary of, you know, who we are, what we do, and wanted to thank everyone for joining. Do we have any questions that we wanted to?
Let's look at the chat and see. Hi, Massimo. Thank you for joining us.
Hello, Massimo.
And also too, like if anyone has a specific, you know, question that maybe we didn't answer, or even if something we didn't touch on, we're happy to answer any questions. Like I said, in a lot of states, patient advocacy is a newer concept. In Michigan, alone. To at least our knowledge, we're the only board certified patient advocates in Michigan. And in the past few years, we've really done a lot of education because nobody really knew what a patient advocate was. And it's actually nice to see where people actually are like, oh, you're a patient advocate. Okay, like we actually know.
They're starting to know
we actually know
what it
you
is,
are.
who we are.
Yes. Any questions from anyone? I'm just like, there's a tiny bit of a lag on the chat, so it might take me a second to see it.
So as Elena's looking for that, we're getting close to our time, and we just wanted to thank everyone. It was great chatting with everyone. We look forward to, we're really looking forward to our next Q&A. So please stay tuned. I think the list of dates are on our Facebook page, where we're sharing all the upcoming webinars. Also, like she mentioned, if even after this session, if you have a question and don't want to wait till the next webinar, please feel free to reach out to us to discuss anything further. Our phone number is 947-517-8395. You can also send us an email and reach us via email at advocate@pathwaypa.com.
It was a pleasure chatting with you all. Again, we will be doing more of these at least once a month, and we're always available too if you want to send us an email like Angela or Gabriella said. And yeah, have a great holiday and stay healthy.
All right. Bye-bye, everyone.
Bye.